If you've worked with us at Movement Cube in any capacity, you know that we believe that your treatment should be specific to your needs, but your training should be sport specific as well. Our tennis players are going to look a lot different when it comes to training than a football player might or a weightlifter. So in our office, what we're going to do is we're going to treat you depending on your sport. Now, tennis players, the incidence of injuries in the lower extremity is the highest. That's what we see the most in the research. Then upper extremity, and then the trunk and head. So we really have to focus on that lower extremity mostly, but second we'll move into the shoulder and the upper extremity, the elbow and the wrist. And third, we're going to focus on the trunk and the head to make sure that that doesn't have any injuries as well. When it comes to treatment, we're going to look at this as well. If your hips aren't doing a good job controlling where your knee or your ankle go, we may end up with a knee injury. Now, the upper extremity, we have to look at that before we look at trunk because we have to make sure that you have stability when we get away from our body. With the elbow, it depends the level of sport that you're at. If you're a junior or an amateur tennis player, you're generally doing more backhanded strokes. That's going to cause different elbow injuries than forehand. So your training needs to be specific to you. Now, in our office, we're going to take you through a full assessment to see what areas of your body may need an adjustment. You may have a spot that doesn't move as well as it should, and then another area has to compensate for that. Then we're going to dive into the soft tissue, which is tailored to you as well. So if you're a tennis elbow patient and it's brand new and it's fresh and you just started hurting yesterday, I may get into that with my hands. If this is something that's been there for weeks or months, this may be something where needling is going to work better. So we have to tailor that to you as well. Now, when it comes to our training, the biggest things that we're going to focus on for our tennis players are going to be the hips, controlling where that knee and ankle go and helping with the low back. We're going to focus on the shoulder and the elbow. Those are two really common areas where we see injuries with tennis players. And we're going to focus on the low back. That core stability is really important because you're moving through all three different planes here. You're not just moving forward and back, but we're going side to side and we're going rotational as well. So let's take a look at a couple of the exercises we may do for this. For our banded wall rolls, we're going to use a band and a foam roller up against the wall. This band is going to go around your wrists, and you are going to be working on a windshield wiper motion with this. We want all of this to come from the forearms moving, not from the wrists. You will keep that motion as we are against this foam roller on the wall. Now with this, I want you to have 1 foot forward, and I want you to keep your rib cage locked in this position. We don't want to arch and let that rib cage flare as we do this. Lock that position in, work those forearms out, and then we're going to work our way up and down. You're going to continue trying to push the forearms out, put some pressure into the wall. As we work up and down, we're going to try to get 10 reps of this, and the outer shoulders should be on fire by the end. So that might be a beginning point for the shoulder exercises that we want to do, but what about the elbow? Let's take a look at one of those. For offloaded pronation and supination of the wrist, we want to start with this weight offloaded. So you're going to grab onto one side of the weight. We're going to lock ourselves in here, and you're going to work your way all the way into pronation and supination here. You're working your way back and forth. Lock this down because I want most of this range to be coming from the wrist and through that forearm. And we're going to work our way back and forth for reps. We're building endurance with this, so we want to bump those reps up decently high. You don't have to have a super heavy weight with this, but as you get stronger, you're going to increase the weight and you're going to increase the reps until we can fatigue that forearm out. We've looked at the shoulder and elbow. Now, what will we do for the hip? Let's take a look at one of the exercises we may use for that. All right, for your DNS stars, you're going to start on your side. You have your knees bent to about 90 degrees. You're going to be up on this elbow with the hand down to get good surface area on the floor there, okay? First thing I want you to think of is this little curve that's happening right here. We want to clear that up and make everything in a straight line. So you're going to turn all this on. Then you're going to push your elbow and push your knee into the floor. You're welcome to use a pad or something for your knee if you need to. You're going to lift yourself up like this. Then I want your top arm to go forward as your top leg bends and goes backwards. As we do this, you're going to drop this hip to the floor and come back up. And you'll feel as you reach across here, this hip gets driven into internal rotation, which is really going to help you fire that glute and use it in the way that we want to, especially for things that are upright, like running and things like that. So you're going to do that for the prescribed sets and reps. Now we've got those 3 out of the way. What would we do for the low back in our office? Let's take a look at one of those exercises. For our same side block dead bugs, you're gonna start on your back with a block on one side. You're gonna put the block between your knee and your elbow, and you will keep tension between those the whole time. You're pushing your knee towards your elbow towards your knee. Your low back should stay plastered to the floor. You wanna keep that there, not letting an arch happen as we do this. These hands are gonna come out, and then the arm and the leg are both gonna work their way out towards the floor, then back up. You're gonna repeat this on both sides and do somewhere around 10 reps per side for a couple sets. Now, these are a great starting place for these areas. And if you look at our blog, you can see that there's more exercises we have in there that you could do for each of these specific areas. But if you're interested in doing sport-specific training for tennis, you could also join our 6-week challenge, which is a strength program where we take you through 6 weeks of working out with us 3 days a week, making sure that you're prepared to be on the court. You're going to be increasing your performance, but you're also going to be increasing your resilience to injury. Because nothing is worse than feeling like you're playing the best you've ever played before, and then you start to feel that knee pain or that hip pain. So if you want to work specifically with me going through this 6-week challenge, go ahead and give us a call.